Hi, everybody. Can you hear me okay? Okay. So this talk is not about community cats, although there is, of course, a cat on the front slide. We need more cats at this conference. And I put this talk, in the operations section because a lot of it is almost philosophical, and yet I'm hoping to make some of it quite tangible and specific. But it's about how you can sort of set the tone and think about things that you may believe are true that may or may not be true. And so that's why it's here in this session. I'm actually presenting the results of 3 or 4 different projects, so there's a whole slew of people who've been involved. And rather than spend 3 slides, I did this nice little Wordle, the little word cloud of everybody's names, but I do want to acknowledge that there have been a horde of people who worked on this, both at the ASPCA and in collaboration with us. So this talk is really thinking about increasing the accessibility and improving the experience of veterinary care. And there's a number of preconceptions that have been out there for a long time. Not everybody has them, and I would guess that most people in this room are fairly sophisticated. What I'm hoping to share is some arguments and or talking points that you can use when you bump into people who are like, no, 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 no. And not all preconceived notions are wrong or completely inaccurate, at least a little bit it can be true. But sometimes we need to sort of step back and think about it and put ourselves in a little different headspace so that things that we've always heard unconsciously might have bought into, that we ask the why and we think about, is that really true? And that's really what this is sort of about. It's a little bit of myth busting. So these are the 3 topics that I'm going to chat about. The first is low cost and traditional veterinary clinics in the same community. And this is a place where I imagine the vast majority of you are involved, if you are, in some kind of a low cost or subsidized or nonprofit, and are on the receiving end of some of the negative things that can happen. And I have some info for you. We started this conference with Dr. Tamimi talking about vulnerably housed individuals, and we're going to circle back to that a little bit. But if you want to know more, I know she's uncomfortable. If you want to know more about working with those populations, she did a lovely presentation at the beginning of the conference. And then I'm going to wrap up a little bit with veterinary communication. It's a very hot topic, something we do variably well. And I have just a few concepts and specifics that I'm hoping will be helpful to people going forward. So how many of you are working in a lower cost clinic, either spay, neuter, or otherwise? Almost everybody. Okay. How many of you think that they're in competition with full cost traditional clinics? And no one. That's what I expected. Good. So now I'm going to give you some information, and we actually published a paper on this so that when the next time someone tries to put together legislation in your community or your state, you'll have something to take to them to say, no, 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 we are not in competition. And that's really what this is about. They're not. I hired an economist. She's one of our research people a long time ago, a few years back, and she's taught me a lot. This actually came from some work that she did with Roger Haston, and it's really rests on the idea that market segmentation occurs. And that's something that's happening a lot now. That's really more business, really, even than economics. But when you start talking about subsidized practices, they're like, well, they can charge less. So that means that people are going to go there, and it's going to take away business from the vet clinics that have to charge more because they're not subsidized. And really what happens then is these legal actions, which occur in multiple states and communities, mean that fewer animals are getting care. And while veterinarians absolutely need to earn a living, we also, I'm a veterinarian, I can say this, we also want animals to get care. So how do we do that? How do we rationalize these 2 opposing, potentially theoretically opposing views? The answer is they're not opposing. They're complementary. So market segmentation is where you have different kinds of options. And I'll show you a video in a minute about airlines because I think that's a really good example and provides us with some really nice talking points when we run into people who are freaking out about this kind of thing. Low-cost clinics target different markets, different people, than traditional clinics, and that's why they're not in competition. It's why you'll have hotels, everything from a Motel 6 to the Hilton to the Four Seasons. Well, they're all providing a bed and a bathroom, but they're different things. And I think for us in the veterinary world, we're a little stuck on the idea that we're still James Herriot. We still do everything for everybody. And we are in the process now of differentiating and segmenting the veterinary market into different slices of the pie. So what happens is that there's clients who will go to lower cost clinics, and therefore those people will get care. Then they won't be going to the full cost clinics where they may not be able or willing to pay full cost, and the full cost clinic will then have more slots for clients who are able and willing to pay full cost. So it's actually a win-win, and that's kind of the gut descriptor of what goes on with all the math and the models. That means that there's a bigger market, there's more opportunity for people to take their pets to veterinarians, and that means that more animals get treated, and that's what we're really all about. So the simple version of this model, which is what we published, has just really people who are willing and or able to pay more and less. So there's just the price differential piece. And historically, there was the one piece, there was the Herriot. And then in the 70s or so, maybe early 80s, you started to see some specialization, and some of the surgeons and radiologists started moving out into specialty practices. Before that, the only specialization was in the teaching hospitals. And then after that, you started to see more specialty hospitals, and then you started to see emergency clinics, which those didn't exist either. And that's all pretty recent. That's 80s, 90s. Now we have corporate practice, which is another thing. Now we have concierge veterinary medicine, which is the very high end. And we have all the options, everything from basic wellness and vaccines to limited services, to people who provide full service, but only at certain price points and in different ways. And that's natural and normal in a market. We don't necessarily like to think of veterinary medicine as a business, but it is. And when you're trying to earn a living, it follows some of those kinds of market segmentation. And this has been really similar to airlines. When it first started, and I'll show you the video in a second, there was one thing, only rich people, and everybody was dressed up and they had their drinks. And then eventually, the airline industry decided that really, in addition to the business people, we want to get the tourist people. Well, the tourists were willing to pay less to get less. The business people needed to be able to fly at a moment's notice. And that's where we are in veterinary medicine, and it's okay. And that's how we're going to get more people and more pets seen.
In the beginning of commercial aviation, there weren't really any classes because everything was premium. That's not to say that planes were very luxurious. A 1920s plane looked like this. But flying was just so expensive that the experience of flying was the luxury itself. It's kind of like how you don't see Virgin Galactic selling first, business, and economy class seats on their planned tourist flights to space. The experience itself is the luxury. Once commercial space travel becomes commonplace, we'll almost certainly see a classification of the experience. But until a transport method is at a cost where it's attainable to the normal person, it's all first class. In 1950, a round-trip coach fare between New York and London was $675. Adjusted for inflation, that's $6,800 today. Roughly the same price as a first-class ticket on the same route nowadays. It's the exact same type of passenger flying in both these seats. What's changed is who's flying further back in the plane. So the story of the development of airline classes really isn't the story of how airlines developed more and more luxurious seats. It's how they cut costs to allow more and more people to fly. It's also a fascinating demonstration of economics. Airlines have figured out a way to sell the same product for different prices to different people. The overall product the airline is selling is the same, no matter which class you're flying. A flight from point A to point B. What's different is the experience within the plane. The first classification of air travel happened in the 40s and 50s. A significant amount of revenue for airlines at the time came from contracts for airmail routes with the US Postal Service. These flights flew with many stops, often overnight or at odd hours. While the planes mostly carried mail, they still had a passenger section. The first class fares got you, for example, on a nonstop flight between New York and Chicago, while the coach fare might get you on a mail flight that left at 2 a.m. and stopped in Pittsburgh and Cleveland on the way to Chicago. While the fare was cheaper and the flight took longer, the experience on board the plane was largely the same. It wasn't until 1952 that airlines started selling the same flights for different prices. One airline, for example, sold standard class one-way tickets between New York and London for $395 and tourist class tickets for $270. It was the exact same flight on the exact same plane. The difference was in the ticket. Tourist class tickets had to be purchased in advance and had no flexibility. You had to fly on the exact flight the tickets were purchased for. As the name suggests, these tickets were primarily for tourists. Tourists plan trips far in advance and don't really need flexibility, so it was no problem for them to commit to one flight. The full fare tickets were for the other type of traveler, the business person. Business travelers, first off, don't typically pay for their own tickets. They're paid for by their employer.
And we'll cut it off there. But many of you have flown, you're familiar with this. It's not a perfect analogy, but the idea is that the airplane gets you from point A to point B, and yet your experience is different. And that experience is based in cost and service and other kinds of considerations that each person makes in their choices. Sometimes you upgrade, sometimes you don't. For veterinary medicine, this model that we've used it's for non-emergent. So we're talking sort of routine kinds of care. So the idea that you segment the market and you make choices based only on cost or primarily on cost, only holds true, is only valid when you push it to a certain point. So it's primarily for non-emergent things. And, sometimes people bristle when we talk about costs, but a lot of what we're trying to do for access to care is find ways that, we can treat animals well and provide decent prognosis at a less costly or less time-consuming way, because that's how we're going to make this possible. These diagrams are all on the paper, and I have that reference at the bottom. So it's a very simple and simplistic model, but it illustrates the ideas. We have a set of people who are willing and or able to pay more, and those are two different things, and we fully acknowledge that, but that's what's important. One is price sensitive, and they can't or won't pay. We talk about people who can't pay, but we've all had the experience of people who come in and we know perfectly well they could pay more, and they're not paying more than $100, and that's the same group here. But what happens is when there's lower cost options available, some people are going to try and go there. But the demand then means that there's a long wait or less convenience or something that makes it less desirable to go. And therefore, the people who can pay and will not put up with that, and they'll go to the full cost clinic. And that's what drives them over. The folks who are unable or unwilling to pay and are willing to put up with the inconvenience or the wait, they will go to the lower cost clinic, and that's what segments the market into the two groups. The other thing that's really important, and this is a very tangible thing, is the bigger the price difference between the two clinics, the better. So it actually is better when there's a big differential. That means that it's more clients will go to the traditional clinic, which increases their revenue and client base. And the price-sensitive owners who can't or won't, but can wait, will go to the low cost, and that increases access. And this graphic is trying to sort of show that. So here is where the difference is very big. The difference between the two clinics' price is very large. This down at the bottom is the percentage. So this is the full-service clinic, and the percent of the market, the percent of people who go there. And you can see at this end, there's a big chunk, and don't worry about the details. The details are not relevant. They're just based on the numbers we put in, but the concept is relevant. When there's a big difference, you can see there's a lot of people go to the low cost, a lot of people go to the full service. When there's a very little difference between the group, you can see that fewer people go to either, and there's this big unserved group of people who can't go because there isn't a lower cost option. And that's this business of what the difference is. So at this end, where there's a big difference, more pets are served. The market is broader. There are more options, especially if you add multiple clinics at multiple price points, and more people and animals get service. So I want to just pause here a second for questions, and also what's the take home for you? So you're welcome to ask a question or share a take home. Who wants to say something? Because it's after lunch and we gotta like stay awake. Anybody find anything surprising? Yes.
Not specifically surprising, but the message is good for speaking to a number of different stakeholder groups, for lack of a better term, from the standpoint that there's market segmentation, so you can speak to it on an economic or business front. And you can also make the argument that when the price differentiation is greater between the two types of clinics, more people and animals get served.
Yep. So the comment is her take home is twofold. One is when the price is different, when there's a bigger, and it's the idea that you have talking points now for people when you're doing it. Bigger price difference is good, and there's market segmentation, and people who are business people, they know that exists and it resonates for them. So was there a comment in the back? Yeah.
I was going to say that I agree with her points, and my points are sort of like that. So, like 20 years ago, when high-quality, high-volume spay-neuter programs started, local veterinarians were not supportive. And now those same veterinarians are sending us a little old lady who has 17 cats and no car and needs help. And so now there is more of a collaboration back and forth with private practitioners, but it's so nice to have data to show that we're not taking business.
Yep. And so the comment was that 10, 20 years ago, there was the same conversation about high volume, high quality spay neuter. And nowadays, in most communities, not all, but in many communities, there's a recognition that that's actually a good thing to have, because you can send the people who can't manage to get their 15 cats spayed to that clinic, and they can get what they need, and you feel like you're able to help people. I had one comment, I think, in the middle. No?
I'm kind of curious to see how this applies to like emergency medicine, because in my experience, people that can't afford that usually don't take their pets to the regular vet. It's when something bad happens, now you have to take it to the emergency, and that's the only option that they have.
Yeah, so the question is, what about emergency stuff? Because, sometimes they end up at the emergency because they couldn't go to a regular veterinarian. So one of the things that we're hoping will happen is that if there are low-cost options in every community, then people will get more basic preventive care. So that will help prevent the need to go to the emergency clinics in the first place. The second thing we're hoping will happen is that we know emergency clinics run into price issues all the time. We've done a survey that we supported with the Tufts gang, who hopefully we'll get that published one of these times. And it's very common, and the emergency veterinarians wish they had more choices. And so we've been talking with them about, what are ways to do this. And one of the papers that we publish is on pyometras that says you don't actually have to cut them on an emergency basis, even if they're really sick. You can put them on fluids, put them on antibiotics, and cut them when you get to them. And we know that the high-volume, high-quality spay-neuter clinics cut them all the time. Well, now we have data that both at an outpatient level and at a basic non-specialty clinic level, they do great, dogs and cats. So that allows us, we're hoping, to convince local private practitioners to feel more confident to take on those things and not refer them, because when they refer them, it's $3,000 to $6,000. When they do them themselves, they can probably do it for half that amount, which is still not very little, but is better.
We actually partnered with our local emergency clinic, and they refer cases to us so they would do the qualifications and try to assess the animal's care, give usually a very large estimate, and at that point the owner would say, unfortunately I can't afford that, but I do have another resource for you, contact the shelter, and we have a low-cost program. So it's not something we advertise, but we were building partnerships to try to help us situations like that.
So the comment was that they have a partnership with their local emergency clinic that they've built. It's part of their active work is to create that partnership so that when someone comes to an emergency clinic and they can't swing the fees, they're able to refer them to the shelter to get that service at a lower cost. And so those are the kinds of things that we need to do, because then we have different options for different people. One more.
Just with respect to your analogy with regards to the airlines, I've actually had a veterinarian in private practice who had an aha moment about this exact conversation say, oh, it's like Whole Foods versus buying groceries at Walmart.
Yep, exactly.
And that was something that really spoke to her.
Yep. So the comment was an aha moment for a veterinarian. Another analogy was Whole Foods versus Walmart, because again, those are market segments for organic food, for example, or non-GMO food, and you can get it at both places, and the price is very different.
I can absolutely understand that is true and that makes sense, but it honestly feels a bit like a cop-out for the private practices that are just going to be increasing their prices, and it just feels a bit like unethical, I suppose, to just say that this is actually an all-right system to move forward with. But in the end, if we are serving more animals that way, then that's probably the benchmark. Well, that is the benchmark that we should be aiming for. So,
Yeah.
you know what I mean?
I think so. So the comment is, it feels like we're making an argument that private practices can charge more and are making more money, and that feels a little uncomfortable. And yet, if you think about it from the, well, we really are helping more animals perspective, is that okay? And I think, some of that comes from the, is veterinary medicine a business or not? And I think in many ways, we have to be realistic that it is. We have no third-party payers like human medicine, even though veterinary medicine is modeled on human medicine. You have your own hospital, you have x-ray, and you have surgery, and you have ultrasound, and you have blah, blah, blah. That's really expensive. The other thing that happens then is, if you have a practice in the area that does just basic wellness, low technology, full care service, then you can use your high-tech hospital for the high-tech stuff. And whenever somebody really wants or needs ultrasound, x-rays, those facilities that cost a bundle to put in and maintain are much busier. And so you actually make more revenue and are more efficient. It's an efficiency question as well. If you want to get away from the cost question, it becomes an efficiency issue. And that's something that veterinary medicine is very poor at, but is something that we can and should really be thinking about. So I think that's the other option. And if you're a practice that likes to do lots of surgeries or likes to do lots of ultrasound, then it gives you that opportunity to do that. The other thing that I think it probably could happen, if we can get our heads wrapped around it, is that we feel as veterinarians, everybody talks about the fatigue and the burnout because we can't do things. Well, if we have other options for people, then we can do things. We can tell people, look, it's not just euthanize or this. It's go here. They can offer you this. You can go there. They can offer you a different option. And so it gives us more choice and more feeling that we can help many more people in many more ways and their pets. So how many of you work with the homeless or vulnerably housed? Oh, a lot. Cool. So those of you who went to Be Honest Talk heard a little bit about this project. But this was the goal of this work was really to say, look, there's nothing exotic when you go to treat pets who belong to people who are houseless. And we did this as a consultancy with the University of Guelph and with Michelle Lem at our community veterinary outreach program. And we looked at their data, and this has been published also. You've seen some of these stats. 10 to 20% of North American folks who are houseless have pets. And I was laughing when I heard the talk, because this is me. I'm very pragmatic. It's like you could say they shouldn't have pets, but the thing is they're going to have pets, so let's do something about it. And they're not going to give them up. And it is a way to engage. I was actually thinking we had a veterinarian who retired from her practice and is looking for a meaningful One Health experience, and I'm like, ooh, she should be working on this stuff. And there's a lot of people. Homelessness has increased. There's a lot of folks who are unsheltered, and it involves everybody. So there's about 500,000 estimated people in the US. So this was Canadian data. We had over 600 owners and over 900 pets. And we used body condition score as a sort of metric of welfare, because we're like, well, if they're really skinny or really fat, then maybe something weird is going on. And when you look at it, the mean body condition score is just like 5.5 out of 9, which is just what you see in pets who come to traditional practices, who belong to people who live in traditional kinds of housing. And it's like, okay. And then we started looking at sort of body conditions, body systems, and what kinds of issues we saw. We saw lots of dental and oral stuff, and lots of skin and ears. Shocking. Everybody, that's what you see in private practice. And then about half were completely healthy. And so we wanted to be able to say then that for veterinarians who aren't comfortable working in this area, from a veterinary perspective, the animals are just like the ones you see in your day-to-day practice. And so they need care. Maybe you can plug into an existing program and volunteer. Maybe you're a shelter and you're offering this kind of work. But if you're trying to recruit veterinarians, it's like, yeah, you'll see the same things you normally see. And there's a few tweaks that you make, but you probably make those tweaks in your private practice anyway, because you have somebody who has an animal who won't take a pill, or you have somebody who's arthritic, or you have a cat who, won't eat the churros goop, the magic goop that you can hide things in. And so that's it. And there's some good resources out there now on how to do pop-up clinics. And it helps pets and people, and it also does this preventive care. And they're out in the community, so preventing infectious diseases, parasitic diseases, potential zoonotics is important. And it is a place where you can get buy-in from people. But I think part of what our purpose for this was that we had a sense that veterinarians were like, well, I don't know what I'm going to find in those populations of animals. And the answer is you'll find exactly what you're used to seeing. So that was our purpose for this project. The other thing is that we do a lot of work in areas of persistent poverty in New York City, Miami, and Los Angeles. And pet owners who live in these under-resourced areas do want veterinary care. Again, many of you are probably not surprised to hear that. But traditionally, it's been like, well, they won't come, they won't do. And sometimes spay-neuter, if you're using that as a gateway, isn't the best gateway because people are uncomfortable with that. They don't understand the surgery. They don't understand why. They may not have any experience with altered animals, or they may be using their animals, dogs, as a source of income because they just don't have income. But almost everybody is into shots. They get it, that their pet needs a shot. They may not know which one or why, but that's not a hard sell. At least that's not what we've found. That's usually an easy sell. And so this is a little bit about communication and non-judgmental approaches. So sometimes limited means can mean people get treated meanly. And we can be very judgmental as a field, both in the veterinary field and in the animal sheltering field. But a lot of folks don't have experience with going to a veterinarian. They don't know what to expect. And if our pricing isn't transparent, they also don't know what it costs to come in. And they may be embarrassed by that, or they may have been treated less supportively the last time they came into a veterinarian. They may have had negative experiences with other authorities. Folks who are living in underserved areas often don't have good experiences with other kinds of agencies because they're very judgmental, or they're harsh, or there's legal issues. And they may be embarrassed because they know that their pet needs care and they just haven't been able to get in. They couldn't take off time from work, or somebody was sick, or it's a pet that belongs to someone who just went to jail, or whatever it is, and they may feel uncomfortable. And so this is about communication, but also about this idea that we've been talking a lot about at the ASPCA about offering a spectrum of care. You've heard incremental care and spectrum of care, and we had a nice definition of that. The spectrum of care piece we have focused on because the idea here is that the veterinarian understands has a conversation with the person and has some sense of what's possible. In the same way that can you pill this cat, or can you put stuff in this dog's ears? And then knowing more about their house and their household and their situation, you can make a recommendation of several options that are across the spectrum from less complicated and costly to more complicated and costly. I had a cat who was diabetic. I was a veterinarian. I knew about shots. That cat, she was on Depo. I actually made her diabetic for other reasons. She had 5 different steroid-responsive diseases. And every time I went to give her an injection, she would hide. If I had tried to give that cat insulin, she would have spent her whole life hiding under the bed. I was like, am I really going to do that to my cat? No. And nobody could tell me what her prognosis was either, which I found very disturbing. We still don't have good data on that. And so I didn't treat her. We gave her some oral medication, and she went on for another 4 or 5 years and died of unrelated issues. So there are times where it's not about cost, it's not about knowledge, it's not about any of those things. It's about what's good for your animal. And so optimal quality care may not be the most expensive or complex, and we need to be really non-judgmental. When we present the options, we really need to do it in a way that says any of these options are viable and good ones, and I feel comfortable. And so one of the things that we're trying to do with the ASPCA is doing grants and our own research that support these kinds of hard questions so that we know, well, what is the risk of doing a pyometra as an outpatient, so that we can talk to clients and inform them and they can make a more informed decision. And so the veterinarians feel more comfortable, especially new grads, feel more comfortable saying, oh, there's actually data that supports this. There's a lot more need for evidence, but we're working on it. We all know communication's important, and I think many animal shelters, there's been a lot of work now in the animal sheltering industry about how we communicate with people who come to our shelters and come to surrender animals, and how we do that in a kind and compassionate way. They're not bad people, most of them. There are a few bad people, but most people really care, and their animal's really important. And the harder their circumstances, the more important their animals are. I think for many of us who are more, middle class, who might not have had to wonder where our next meal is coming from, COVID made our lives so freaking crazy that our animals were like the only thing that got us through it, or our kids or spouses or whatever we had. But it was that social support that was so critical for us to survive. And so it's really important for practice because you get more clients and more animals get seen. We can address neglect. This connection between cruelty and access to veterinary care is one that a lot of people, I see nods, but there's a lot of people who haven't thought about it. Neglect is cruelty. It is defined that way in almost all the statutes. And being able to get an animal in and do grooming, that's one of the biggies that I'm sure many people see. Being able to do the vaccines to completely prevent fatal diseases. It's such a big thing that we can do that and help people understand what's going on and prevent animal suffering and help people do a better job with their pets. They just don't know. It's also good for the staff. I mean, if you're really helping people, most of us are in there now and we really want to make a difference. We want the pet to be happy. We want the pet to go home with their people and have a good life. And in this time of burnout and turnover, things that improve morale and make people feel better are good. So there are certainly challenges. And while I say training in veterinary school, there are a lot of veterinary schools now that are working increasingly on communication. They have community practice opportunities. They get to work with people and animals from different walks of life that they might not have interfaced with, so they get some comfort in those areas. I know there's concern about what other veterinarians are going to think of me if I offer this kind of practice. It can be kind of a judgy group. There's also the worry about the legal pieces of it, and that's something that's out there a lot as well. Am I going to be penalized by the state board or sued or something because I'm offering suboptimal care? And that's where the evidence, as well as the communication and the recording of the communication and the medical record, is so critical. Clients' lack of experience with veterinarians, it may take longer to help people understand what's going on. We actually have a whole slice of people who work with our clients to help them navigate our system and understand what's going on and follow up with them, in addition to the veterinary technicians and the veterinarians, because many folks either have no experience with practice or are just so overwhelmed that they need some additional help to do this relatively easily. Communication, I think it's changed, but when I went through, most people went through because they liked animals and not people. And we tend to be introverts, so we don't know very well how to communicate. And we may not have had people really coach us on that. Non-English speakers. We have an enormous number of languages now that we're dealing with. Spanish is a biggie, but in LA we have Mandarin and Cantonese as well, and trying to find folks who are fluent in those and can explain the veterinary side of things, how do we translate things into written language? We're working with a company, but they're not they're struggling too to figure out how to really translate this. And then even Spanish, you talk from people from different countries have very different words or very different nuances or connotations of the different words that they use. And cultural competency, understanding what someone else is. We sometimes talk about cultural humility as well, but it's just not something we've thought about. We've been a very homogeneous, and by we I'm talking about veterinarians here, but I think animal welfare as well has been a pretty homogeneous group for a long time. So these are just challenges. So for this group, what are some options to address the challenges? What are you guys doing now?
We've created more of like a case management style and almost like a social work type of way of dealing with the public and clients. So it's more one-on-one, and you take more of the time to listen. It takes more time, but you create more of that relationship and understanding for them.
Yeah.
In the long run.
So one solution is it's kind of a case management solution, almost social work, where there are folks who spend more time explaining things and building that relationship. And you can do that outside of the visit as well. So that allows you to segment the work. You have someone who does that, and then the actual veterinary stuff can happen in the exam with the technician or the veterinarian. Allows you also to leverage your veterinarians better. What else?
We really were focused on a resource approach, and each department was a part of that. So we had our behavior team available, our intake or admissions team available, and veterinary team available. So as they would communicate with us what their needs were, we could get them to the right person that was the expert and hopefully provide a resource. If we couldn't provide a resource, then we'd find something within the shelter. We developed a lot of programs actually just specifically for this. We were having trouble finding how to advertise that, though.
Mm-hmm.
And we really didn't advertise. So I don't know if there's an approach for that, but that was really one obstacle that I remember facing. We weren't sure that it'd be too overwhelming maybe to advertise.
Yeah. So what they really created a whole program where they listened to what the issues were, and then they had behavior, and they had this. It's very holistic, and they had within the shelter and across the community had different resources to connect people to, but they were concerned about advertising it because of the potential for getting swamped. And I think many people are in that boat, and many of the people that we see are really word of mouth, or they see one of our mobile units out for that visibility piece. And it's real, because even middle class people are struggling. They might have lost a job, or they might have lost a home, or they might have lost a spouse, and maybe it's hard because there is a lot of need, and particularly now when there's a shortage of staffing. Other creative things that people have done, or other things that people have found worked?
So you spoke earlier about your work with the Ontario Veterinary College, and they were able to get a grant from a foundation to develop a program specific to training the students who are coming up about community care and access to care issues. So they've got kids in the program who volunteer in local communities doing some of the community outreach piece.
Cool.
And that is helping to engage and educate those people coming up into the sector.
Yeah, so Guelph was able to get a grant for veterinary student training, which also got them actually out doing the work. And there are a number of other vet schools that are doing that kind of work. So I actually think this is going to get a lot better in the near term once people decide they're working again. I don't know how people aren't working, but they aren't eventually. But I think that the upcoming veterinary students, and actually some of the folks who are on the other end who are looking to retire, are interested in doing things differently. And I think finding people who can interface with the public in different ways is going to get better. So the other kinds of things that are really specific that we've heard about are this idea of asking open-ended questions. This one is not rocket science, but it's definitely something that I don't know that we've all thought about. It's very easy to ask simple yes-no questions, especially if time is short, or there's a lot going on. And yet the open-ended questions, good ones, are how you find out what's going on with the person or the pet. And there's some nice resources out there on this. The AVMA has a language that works ebook that's available, which actually isn't bad.
I found the one thing that was really, really helpful for me was creating a partnership really quickly and using we and creating a common goal. Then it's us trying to help the pet together.
Yeah.
And judgment-free zone, and we're going to get there. Let's just talk a little about what's going on. And by creating that partnership, I found that it was almost instant. I was able to gain the information I needed to be able to help that pet.
Yeah, so the comment is create a partnership with the human because it's we trying to help the pet. And that perspective almost instantly moves you forward to being able to start solving problems. And that's, they care about their pet. They're very attached to their pet. So knowing that you care as much as they do and genuinely want to help is important, which goes to the second bullet. The other thing is, again, we're often high-paced and people sometimes need time to process. We all do. If you go in there and you thought your animal was healthy and you found out it had cancer, you're going to darn well need time to process. And we're much more accustomed to these kinds of things than many of the clients we're talking about. The other thing is, how do you include the clients in winnowing out what your options are? That's where you have to ask things like, if you say, can you give your dog an injection? They might say yes, but they might not really be sure they can really do that. So you could say instead something like, how would you feel about giving injections to your dog at home? And we're used to asking, can you pill your cat? But, how do you think your pet will tolerate being in the hospital or returning for multiple visits? I don't remember anyone ever asking me that when I go to the veterinarian. And yet it's always something I think about with my animals. What's your ability to come back for recheck exams? What's your budget for pet care? Really simple things, but they're not part of our vernacular typically because we have our routine we go through. The other thing is that people tend to choose the first thing you present. So if you typically present the most complex or costly thing, that's what they're going to select, whether that's the best choice for them or not. So you need to figure out ways to present it in a less biased fashion. Be really transparent with costs. I know many of you post on your website or have that available. That really, and opening that conversation of cost up, that it's not a bad thing to consider costs is really important. We're allowed to show empathy. We were sometimes taught that we had to be the cold professional, the whole paternalistic, we're in charge, we know the right answer, you have to do what we want to do. And we're really changing that kind of relationship for the most part. You can also survey your clients and see how it's going. One of the papers that's cited here is the result of a survey of how did it go at Asheville Humane Society? And did you feel like you were treated with respect? And did you understand what people explained to you? And they did really well. There were a few places that they could do even better. But you can do that. It's not that difficult to do. I also found out about a thing called pockettalk.com, and by the time I'm presenting this now, there's probably 4 others out there that'll translate simultaneously for you. So if you need to, you can have that with you if you don't have people who are multilingual in whatever area you're dealing with. I can't swear to its accuracy, but it's a help. The other thing that I know a practice that does is they'll actually have someone who has the right language have a whole conversation with the client before they come in. And then by the time they come in, they know what's going to happen and who's going to do what, and they don't actually have to have someone on site who can speak the same language, and then they have the communication, and the communication happens again afterwards with the person with the right language. So it's kind of a pit stop with the vet, and they have someone else who's able to do the communication. It's not ideal, but it's better than nothing. So we're really about trying to get pets have more care, and that's, I think, where we have to ground our brains. And how do we do that? I think this is a great place for staff, especially staff who might feel undervalued. And again, they have to be people who like people. They can't be people who hate people. Owners really do want to help their pets, and they have other life constraints, things that many of us can't imagine. And they may live in places that we wouldn't let our dog visit. I mean, that's very judgmental, but it's true. And how do you work on yourself so that you're able to be empathetic with someone whose life is so different from our own? And yet their pet is so important. And they want to show you pictures and tell you about their favorite toys. The other thing is handouts. It's one of my bugaboos. I don't know that we've done as good a job as we might when we write the take-home things that we send home with clients. Even apart from literacy and language, we're still using complicated words. We're not making it as straightforward and as obvious and as clear as it ought to be. And we're actually looking to do something where, for ear cleaning, we give verbal instructions. Well, then we can give written instructions. Well, maybe instead of that, we want to do a cartoon diagram of instructions. So we're looking to do some of that. They've done some of that work in the human literature for patient compliance, but we haven't done very much at all with how easy is it for owners of animals to comply with our recommendations. There's really been nothing done. So no, not all preconceived notions are right. This is a pretty savvy group, but hopefully I've given you a few more things to think about and points to share when you do run into people who are still stuck a little bit in some of these. More types of veterinary clinics do increase the options for care. People who are houseless, their pets are just as good shape or not as others. And there's lots of different ways to partner there. If you don't want to start your own program, see if there's a social service agency that you work with or a public health agency. That's a group we haven't necessarily worked with a lot, but they're all about rabies and vaccines and deworming, and those are all things that we love to do. And so maybe you can set something up. We've worked with the Department of Health for vaccine clinics in New York City because they wanted to get animals vaccinated and licensed, and we wanted to too. Increase the number of resources. It's all about relationships. It's never what you know, it's who you know, which is kind of still hard to fix sometimes. And we want more happy cats. Those crazy orange boys. So I have a tuxedo. I don't have an orange boy anymore. So I would like to contact you after the conference if you're willing. So please send me your name and email. You can email me, you can text me, or you can drop off a business card or write in my book, which I will have out of my bag in a minute. Because I'd like to see if whatever you decided to take home with you, which we'll talk about in a minute, if you were able to use it. And if not, why not? Because, as I said in my cat talk, we come here, we're really excited, we're really jazzed, and then we get back and there's the swamp of 400 emails waiting for us. And our best intentions sometimes fall by the wayside. So I want to give you guys a minute to just think about and ideally write down, what are you going to take home and do? What specifically are you going to do with whatever you've heard today or thought about today when you go home? Are you going to talk to somebody about X? Are you going to look up a resource? Give yourself a tangible to-do that you'll take home with you.
Is this part of a study that you're doing?
There isn't a study. It isn't actually a study, but what we're really looking for is to see the impact of our work and to try and understand how we can make conference presentations as impactful and useful for people as possible. So it's really a sort of a program evaluation. Oh, yes, sorry.
It's creating those relationships, I guess, with the private vet community and the emergency community. That's the biggest issue that we have. Because they have unrealistic expectations of what we can offer, how we can offer it, and at what cost we can offer it. So it's creating that divide with us and the community, because then the community gets very angry with us that we can't help them in the way that they were told, because the other organizations and businesses and vet clinics have this unrealistic expectation of they can just deal with it, they can handle it, when it's like over a nonprofit,
So what are you going to do specifically?
I would think of, creating meetings with, the CEOs or the head vets of local clinics, just to give them a presentation of what we offer, how we offer
Great.
it, and the costs, because they think we have infinite funds.
Right,
and
right.
We don't.
Yeah.
And that's the biggest thing. We do what we can when we can, but lately we've been having to say no or offer other resources because we're getting overwhelmed as they
Yeah.
are. But
Right.
now it's creating that divide between us and the community that we've been
Yeah.
working so hard to rebuild that relationship.
Yeah. So the comment here is, the shelter's relationship with the private practitioners and the emergency vets is becoming increasingly strained, even though that's been something they've been working with the community to really connect with, because their expectations are more than they can really afford, and everybody is overwhelmed and everyone is looking for help. So trying to be realistic and sitting down with them and sort of telling them what you can do and what you can't do. That's really helpful for your staff as well, so that they sort of feel like they have a handle on what they are expected to do, and being able to refer to other resources. It's very, very, very hard to tell people no, that we can't help. That's why we're here. So acknowledging that's good. Thank you.
I have a question.
Yes.
I wonder how important, or if it's even necessary for low-cost clinics to verify financial status.
Yeah, so the question is about the importance or need of verifying income status. And I think it depends on what your goal is and what your mandate is. So if you're a nonprofit and your goal is to serve the poorest of the poor, then perhaps you ask people if they're on public assistance, or if their income is below a certain cutoff. If your goal is to provide care for people who can't afford a traditional clinic, and maybe you're not a nonprofit, maybe you're a for-profit, but you only do certain things, then you have to decide who it is you're trying to serve. So I'm not a big fan of making people show you stuff, but there are times where asking people for their eligibility is okay, and you take them at their word. That's the direction I go. And I think it depends on the mission of your organization. It really does. That's kind of a widgy answer, but that's where being really clear about what you do and don't do and what you're trying to accomplish is going to help you figure out who are the right who's to come to your practice. Especially in times like this where resources are so limited, we're always going to have to say no to somebody, always. So who are the people we want to say no to, and how do we want to decide that? That's up to each organization based on what they're trying to do and who they're trying to serve.
We actually did both models, one with qualifications, one without, but just asking a question, so proof of credentials, no proof. And our intake increased by 50% with applications coming through over about a 6-month span. So it went from a 3-month wait time to an 8-month wait time.
Wow.
Just by removing the proof of credential. So for us, we actually ended up shutting down the program to catch up to the backlog. So at this point, we're trying to evaluate
What to do. Yeah.
That's exactly what we did too. We got like a 500 people waiting list.
Yeah. So the comment here was that they had been requiring proof of need of some sort, physical proof, versus just the conversation. And when they switched to just the conversation, the numbers of people increased dramatically, and they actually had to shut programs down because they were overwhelmed. The question then becomes, and everyone is debating what to do now. One of the questions is, how much time does it take your staff to look at the approvals, at the physical things, and is that actually then saving you money, or could you redirect some of those people elsewhere and put the people and the money into other places? So what's the cost benefit as well, not just the time? Because sometimes it's such an onerous, and I don't know about yours, but it can be such an onerous or long conversation that it actually is costing you way more than you think it is. And we don't always think about that kind of cost benefit for staff time, looking at those credentials, and at the human's time, the pet owner's time, because many pet owners, their time is money, they're hourly workers. And so if it takes them an extra half an hour to get through, it costs them an extra half an hour of their salary. And so just other things to throw in, I don't have an answer, but just some more things to be thinking about. Yes?
Our shelter offers a low-cost spay and neuter voucher, and we have it open to anybody in our community, anybody in our county. All of the veterinary offices in our county accept them. And what we've found is because we don't base it on income, more people who have a little bit more money are helping to take care of like cat populations that need spay and neuter. So by not limiting it to low-income people, we're finding that it's actually helping the community in a greater way than just the low-income families that need assistance.
Yeah, so the comment is that they do vouchers for anyone in the county, and it's not income limited, and therefore they actually get people who have a little more means who are able to provide donations or time and help do more than they could have otherwise.
The vouchers allow them to, they'll come and get a voucher from us.
Gotcha.
And then they'll get a community cat spayed or neutered.
Gotcha. So they're actually engaging in community cat spay neuter because they have a voucher. So it brings in people into the system who might not otherwise come in, which is another sort of cost benefit that you might not be thinking about. Yeah. Questions? Oh, the other thing, so here's a bunch of the references. If you look at aspcapro.org, we try and post our research as it's published. Sometimes it's the full paper when it's open access and accessible to all. Sometimes it's just the abstract. But we try and publish the general sort of what's the take-home message from the paper so that it's accessible and available. And that first modeling paper is this first bullet here, the simulation of the effect of low-cost companion animal clinics on the market for veterinary services. And we really wanted to publish that so that the next time the legislation comes around, we can take that to the legislators and hopefully to the veterinarians and make people feel better. But there's also some general references on spectrum of care and on communication and on treating pets from people who are vulnerably housed. So that's a good place to go. And again, my slides are here. So, all right. Thank you, guys.